Have you ever thought to yourself, am I crazy? Well, you're probably not crazy, but in the event that you actually are, I can promise you that most likely you have nothing on the people who have the mental disorders that we're going to be discussing in today's video. Because right now we are counting down the 5 most unusual mental disorders that are clinically recognized. Starting with number 5. Alice in Wonderland syndrome. Alice in Wonderland syndrome, or AIWS, is a neuropsychological condition that causes a distortion of perception. People who have AIWS typically experience distortions in visual perception of objects, such as seeing these objects smaller or larger than they actually are, or even appearing to be closer or further away than they actually are. The cause of AIWS is currently unknown, but it has often been associated with head trauma. It has also been theorized that it can be caused by abnormal amounts of electrical activity, resulting in abnormal blood flow in the parts of the brain that deal with the process of visual perception. Currently, there is no standardized treatment plan for this condition. Number 4. Erotomania. Erotomania is listed in the DSM-5 as a subtype of delusional disorder. It is a rare paranoid state of mind that is characterized by an individual's delusions of another person being infatuated with them. This disorder is most often seen in female patients who are shy, dependent, and sexually inexperienced. The object of the delusion is typically a male who is unattainable due to his high social or financial status. The subject of the obsession may also be imaginary, deceased, or someone the patient has never even met before. The erotomanic person often perceives that they are being sent messages from their delusional subject through innocuous methods, but will never actually be able to show proof of this. Recent research suggests that social media is known to heighten erotomania due to the plethora of information available about other people online. One real-world example of this disorder played out in an episode of Dr. Phil, which included a 21-year-old girl named Bailey. Bailey says she met a girl named Jasmine on social media 8 months prior, and that it was love at first sight. She talked about how intense her love for Jasmine was. She stated that it was the greatest love story of the century and that she was even planning on writing a book on it. She says that they were communicating constantly, day and night, and she spoke about how strong their bond was. But in actuality, Bailey had never spoken on the phone with Jasmine, nor did Jasmine meet her ever, or even knew who Bailey was. These two literally never spoke a word to each other, yet Bailey was somehow convinced that their love was inseparable. Number 3. Alien Hand Syndrome. Alien Hand Syndrome, or AHS, is a category of conditions in which a person experiences their limbs acting seemingly on their own free will, without conscious control over these actions. The affected person may sometimes reach for objects and manipulate them without wanting to even do so, even to the point of having to use the controllable hand to restrain the alien hand from doing something that is completely unintended. There isn't one particular cause for alien hand syndrome, but in all cases, it seems to be triggered by some sort of damage to the brain in a way that disrupts your movement and control. There is no real treatment for this syndrome, and all the techniques to manage it are mostly just anecdotal. Number 2. Factitious Disorder. People who suffer from factitious disorder will deliberately attempt to fabricate signs of physical illness or injury to receive medical treatment and/or care within a medical setting. And that is their whole goal here. There's no practical benefit from just receiving attention. It's purely psychological. In some cases, some people will actually receive unnecessary surgeries. Those who experience it often endure quite severe emotional difficulties and are at high risk of attempting to harm themselves so they can gain more treatment. Now, it's thought that some of the motives for doing this can be for attention, to avoid an obligation, or just to obtain a material benefit. The causes for factitious disorder are mostly unknown for the moment, but one possible cause is psychological trauma. It also is suspected that this condition may be hereditary. Number 1, body integrity dysphoria. Body integrity dysphoria, or BID, is a very rare condition. It occurs when your mental body perception doesn't match your actual physical body. If you have BID, you may have a strong desire to amputate a limb or seek to become totally paralyzed. People with BID just want to be their true self, which often comes with a desire for amputation of limbs or a disability to help them feel complete inside. People with this condition feel like their bodies are not what they should be. And in severe cases, people with BID will go to extreme lengths to amputate or disable themselves without any medical help. This obsessive need to amputate a limb can be deadly if the amputation is not done correctly. And unfortunately, people with this condition can turn to self-mutilation if they cannot find the proper help. Body integrity disorder isn't well understood. There isn't one specific cause of BID, but there are theories such as childhood trauma and extreme OCD which may contribute. The most challenging part about this condition is that there is no cure. Treatments like cognitive behavioral therapy and selective serotonin reuptake inhibitors can reduce the distress and depression that is related to this condition. However, they don't ever really feel removed from the desire to get rid of their appendage. Alright guys, thanks for watching this video. That last one really got me. Not gonna lie, crazy stuff. But anyway, we'll catch you soon.